The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, reproductive endocrinologist Dr. Robert Kaufman talks about how his fertility practice offers the highest level of multidimensional patient care. Interventional cardiologist Dr. Annie Varghese talks about cardiomyopathy. Clinical psychologist Dr. Collins Hodges discusses how he is able to help families adapt to life changes. Cosmetic dentist Dr. Guy Lewis talks about his philosophy and approach to practicing dentistry. Houston Northwest Medical Center highlights their nurses' commitment to patient care as well as to their community.
At Fort Worth Fertility, what we really want to do is help our couples get pregnant, and we really believe this is the place for them. We can provide them with the best care from an emotional standpoint, from a success standpoint, and we can make you feel like you're in a unique situation here where we'll treat you as an individual and we'll do the very best we can to help you achieve your goal. We look for unique situations for our patients. We try to tailor what their individual needs are. I think the importance between our center and other centers would be we're very upfront with patients. We let them know what their expectations to get pregnant are. We let them know what it's going to take to get pregnant. We know financially what it's going to take for them to get pregnant. In addition, we offer numerous treatments. We offer inseminations where we put sperm inside the womb. We offer in vitro fertilization where we'll put embryos inside the womb. We can offer surgery. We can offer fertility medications. And there's a host of other things we can offer patients at this center. Everything under one roof for the convenience of our patients. Our typical first patient appointment is where we'll actually spend probably about an hour talking about things. We'll talk about their history. We'll talk about possible evaluations they may need. And they'll even start talking about potential treatments. When we talk about treatments, we'll let them know what their chances of getting pregnant are, how much it's going to cost, and what do they need to do. And so we really try to evaluate it thoroughly so we don't miss anything, so we can give them the best options to get pregnant. We're very proud of our egg donation program and surrogacy. We're known internationally for that. So it's not just Fort Worth. You think, oh, we just get doing things in Fort Worth. But we really see patients from all over the United States and all over the globe. And we're honored enough to be able to treat those type of patients here in Fort Worth. The other aspect here at Fort Worth Fertility is our staff. I think we have an outstanding staff, and we all need to work as a team to get the job done. We do know there's a lot entailed in helping our patients get pregnant. But we do try to find a cost-effective means to try to get our patients pregnant and give them our best advice on how to accomplish that.
Dried plums or prunes are packed with polyphenols, a plant chemical that has been shown to boost bone density by stimulating your bone-building cells.
So John is a wonderful man. He is a father, he works every day, but unfortunately he developed coronary disease at an early age, weakening of the heart because of that. So when he presented to me, the heart function was very poor.
I was a jock, watching my diet. I loved exercise. I ran marathons. I was an NCAA certified basketball and football official. And the people that I work with, they knew me and knew that I was a fairly healthy person. So when they found out I had a heart attack, everyone was floored.
Heart failure means the heart becomes weak, whether it's because of blockages or other things. Viral illnesses can cause heart failure. But for him, it was blockage, not getting enough blood, so the muscle became weak over time.
Before I started seeing her, they wanted me to run through a battery of tests. And when she saw the results of those tests, and I believe she was on maternity leave at the time, she came in and wanted to see me. And it was at that point she actually brought up that somewhere down the road I may actually need a heart transplant.
Over the years, he's been evaluated by the transplant team, and he didn't need a transplant because we had taken great care of him, and he's very thankful for that, and I'm thankful for medications and therapies that we were able to give him to keep him really controlled on heart failure.
Dr. V is an amazing person. I owe quite a bit to that woman, and I feel very fortunate that she's my cardiologist.
He did have a device, a shock box put in, so that in the event of an arrhythmia, because the vessels are not working and the muscles not working, so electrical abnormalities can occur, and people can have sudden death from heart failure. So we protected him by putting a shock box. And he has been able to work every day, but he takes his medicines and he's doing great. So that's a great testament to having great doctors paired together and great institutions to take care of patients. And we're very blessed here in Texas because of the Texas Heart Institute.
Find your doctor on bestdocsnetwork.com.
My son was going through a transition of graduating from high school and entering a new chapter in his life. And so I think there was some anxiety on his part. There was some anxiety on my part. It was coming out in negative ways, and we had to identify what's going on. And we needed somebody, an outside person, to kind of help us mediate and facilitate through some of the feelings that were going on.
Alma and Quattro were great. I really enjoyed working with them. They were both very sweet, very bright, very interested in working in therapy. They initially came to see me because Quattro was moving along in his development. He was moving into young adulthood, moving off into college, and part of the conflict there was, what is his move into college and his developmental move into young adulthood mean in terms of the renegotiation of boundaries between mom and son, and then the renegotiation of roles between mom and son.
Dr. Hodges provided a great environment. He's a facilitator and a mediator, and that's what me and my mom needed in our relationship at the time.
The main change that I saw was a better understanding from each of them as to what their new role was going to be. They both came to a better understanding as to who they were, not only as individuals, but as a close mother and child.
Dr. Hodges gave us some really good guidance and encouragement, and through love and trust, we were able to get through some tough spots and have some success.
After seeing Dr. Hodges, it just gave me and my mom a greater respect for each other as individuals, and just has taught us to learn and grow with each other. Dr. Hodges has helped me realize what progress is and how to obtain it.
Eating eggs for breakfast not only tastes good, but they help to slim you down. Each egg you eat has 6 grams of protein, but only 72 calories.
Terry has a question for Dr. Steve Duffy. Is there a downside to not having a gallbladder?
So we treat a lot of gallbladder disease here in Texas. And that's one of the most common questions we get is, what is my life going to be like after surgery? The most common thing people notice is that for the first couple weeks as their body's adjusting, if they eat fatty foods,
Ask our doctors on bestdocsnetwork.com.
bowel function. But once your body's adapted after this period, you can live a normal life with essentially no dietary restrictions.
Well, my goal is to give people what they want as much as I can, and usually I can do that. I pretty much have been blessed where there's not very many people that say, I can't help you. In fact, I can't really think of anybody. We try to give them a great smile. We do a lot of things that other dentists have told them, well, no, I can't do anything to help you. And I've actually had dentists who refer patients to me, so I'm very honored by that. We try not to just go in and, just do it a cookie cutter type, one size fits all. I try to individualize it for the teeth because I want to be as conservative as I can. I want to do it as comfortably as I can for people, minimal invasion on their tooth structure that's in good shape. So I'm not just trying to talk everybody into doing veneers or doing crowns or whatever. I mean, some people come and want that, and that's fine, but I try to give them options. I try to say, yeah, that is an option, but here's another option, and this might be better for you because ABC. And so we try to work with them and work within their budget and what they can do and what they want to do. What I love about what I do is how it changes people's lives, especially someone who was unhappy with something that had done earlier, that came here to get it fixed. Because they're more desperate sometimes than the people who had had anything done. They're disappointed, they're hurt, they were wanting something and they didn't get it. And to be able to take someone like that and to show them it's okay, it can be fixed, it can look fantastic, and to take them and to guide them through that and help them achieve what they wanted to achieve originally and fix it for them is really satisfying. It really makes you feel good about what you're trying to do. I had one guy in with his wife, it's like she won't shut up about her teeth, and she's talking to everybody about it. And so I love that. And getting Facebook posts from patients and talking about how I love my dentist and things like that. I mean, that's awesome. There's a lot of satisfaction in that, and I really enjoy that.
Did you know eating oysters can keep your immune system strong? A 3-ounce serving has 1/4 of your daily iron intake, plus twice the zinc that you need in a day.
At Houston Northwest Medical Center, we're immensely proud of the wonderful group of nurses that we have at our hospital, not only for the care they give to our patients every day, but also for the way that they've reached out and become so involved in our community.
Their commitment to the patient here at Houston Northwest is amazing, but in addition, above and beyond these 4 walls, they carry it out to the community. And that's evidence in all their volunteer work, through runs, through patient support groups, through educational opportunities they offer to the community.
One of the reasons that I really like working for Houston Northwest is its philosophy, its commitment on giving back to the community. And so when an opportunity came up from Spring Independent School District for me to be a part of their education foundation, the hospital was very supportive in not only its financial resources, but allowing me the time to be able to participate at a high level of engagement with our school district.
Race for the Cure has become a really important tradition here at Houston Northwest Medical Center. Living the walk with these ladies, they allow you to walk beside them, behind them, in front of them, holding their hands. That's very important. That's something you cannot buy or you can express in words, really. I'm very honored. I am honored to be part of their lives and do whatever I can to help them along the way.
When I first started working here is when I got involved in the Heart Walk just as a participant. And after just participating for a couple of years, they asked me to kind of take it over. And so now that's what I do, is I help raise money for the American Heart Association Heart Walk.
Relay for Life is the biggest fundraiser sponsored by ACS. So American Cancer Society is always collecting donations to go towards patients that are underprivileged or that need resources when facing their diagnosis. It's humbling because I get to see patients come in that get a diagnosis that is life-changing, and then to be able to see them walk around the track as a survivor or one of their family members to walk around the track in remembrance of them. I feel lucky that I get to be the person to represent our hospital in that.
I love my job. It's fun. It feels good to be helping people live a healthier lifestyle.
Obviously, we're very proud of the quality of care that's provided at Houston Northwest Medical Center. And our nurses are the driving force behind that. But their commitment to quality care and their commitment to our community extends well beyond the walls of our hospital through the many charitable and healthcare awareness events that they participate in actively throughout the year.
I think that gets to the core of nursing here. There's a heart, a big heart.
I didn't feel good about myself and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Coming up on the second half of today's show, gynecologist Dr. Scott Lauer talks about how the InterStim device can successfully treat urinary incontinence in women. Family medicine doctor Richard Honecker addresses common health concerns in our Medical Minute. Oral surgeon Dr. Paul Metz improves his patient's life with dental implants. Vein specialist Dr. Peter Morgan talks about varicose veins. Minimally invasive spine surgeon Dr. Douglas Wan talks about his approach to spine care.
I always felt as if I had a bladder infection, and I had been on antibiotics for a long time. You always feel as if you need to go to the restroom, and then when you get there, nothing's happening. There's a lot of abdominal pain. It's hard when you're good for 1 second, and then all of a sudden, you're down for the count.
Jolene's a very interesting case. She presented with pelvic pain and urinary urgency. She had had several laparoscopic procedures. When she came in, she had multiple urinary tract infections, treated by a family doctor, would never get better.
It was kind of unexplainable. You know, I would do all of the things you would do if you got a bladder infection. You know, I would drink water only and this and that. Sometimes it would just last for the day. Sometimes it'd be a couple days, but it would just come and then it would go, you know. Other doctors in the past, they would just give me antibiotics. I didn't have a bladder infection.
True urgency is basically when you get the symptoms, I gotta go, I gotta go, I gotta go. The InterStim works by stimulating the nerves from the sacrum that innervate the bladder, and it can act as a amplifier for the signal, or it can act like a reduction. You know, it's getting overstimulating. She stopped the medication on her own, said, what can we do? I told her we could try a trial of the InterStim procedure.
I wore it for a week and it helped. I fell in love with it, and then I decided that, yeah, this is what I need, and then we went back and put a permanent one in.
With her InterStim procedure, Jolene basically is treated or in remission. She's actually doing excellent.
I think it's been right about a year since I've had it. I don't know what was happening inside my body, but that InterStim did it. It fixed it. So for me personally, I mean, it's just made me, I don't have to worry about it. You know, it's just, I feel great. I always feel good. I don't ever have that issue.
Request an appointment on bestdocsnetwork.com.
We've all had heartburn. Now, it's kind of odd because it has nothing to do with your heart, but it sure does burn. And what causes it? Usually it's when acid leaks up through that little round muscle that's supposed to be nice and tight and keep acid in the stomach. That acid leaks up into the esophagus. So what makes that happen? What loosens up that little round muscle? Alcohol does it, caffeine, chocolate, cigarette smoke, peppermint, spearmint, tomatoes, that kind of stuff we're all guilty of. So what do? You go out to a restaurant, you have a drink or two, you eat a fatty meal, and then as you leave, you take a peppermint with you. And all of that relaxes that little muscle so the acid can come north. You go to sleep and lie down in bed, and boom, the acid's in your esophagus. That's no fun. It can cause painful burning, even some hoarseness as the acid leaks up and irritates your vocal cords at night. So what can you do? Well, first of all, reduce those things I just spoke about. Secondly, you can get over-the-counter medications. There's two kinds. There's strong stuff and there's weak stuff over the counter. Ask your pharmacist which one might be best for you, or ask your doctor.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in two settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas. In majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a three-dimensional standpoint radiographically ahead of time so as to know where the bone is, so that we can position implants within that bone and avoid the need for sinus grafting, and then subsequently lower his overall costs significantly, as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling, and being much more confident. So it from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and of high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
Sarah has a question for Dr. Paul Chung. What is a rotator cuff?
It's a set of tendons and muscles that run around the shoulder and help hold the ball in the socket. Its purpose is to keep those two components together so that you can lift your arm. So if your rotator cuff isn't working, then you're going to have trouble with moving your shoulder, especially moving it up. People who have rotator cuff problems often have pain on the outside of their shoulder, and they often have pain at night that especially even wakes them up. Certainly trouble sleeping on it at night or rolling over on that side, and some weakness. And so all these things are really common complaints of people who have rotator cuff pain.
Ask our doctors on bestdocsnetwork.com.
Find out more about your family history. Finding out what your grandparents died of can provide useful and life-saving information.
For numerous years I've had varicose veins. I'm a registered nurse, and so I have been on my feet for 20 years, and also heredity has played into that. And so just a lot of varicosities and some pain, aching if I've been standing on my feet for a long period of time, and then just unsightliness.
Varicose veins are a symptom. They're a sign of an underlying disease or abnormality in the venous circulation. In your legs, there is no heart to pump the used blood back up, and so the pumps are your muscles. And when the veins become too large and one-way check valves have failed, now all the pumping doesn't work and the blood pools in the legs. It creates high pressure, which results in bulging, enlarged veins that we call varicose veins.
My dermatologist recommended Dr. Morgan, and he was very forthcoming with information. It wasn't a lot of extraneous things that I didn't understand. It was very to the point, you know, exactly what he could do for me and what the benefits, what the side effects, and it gave me an opportunity to just weigh the pros and cons of whether I wanted to go forward.
The treatment is to close all the veins that are running backwards. Any vein that is not pumping up out of the leg is only hurting, it doesn't help. And so by removing or closing those veins, you restore the circulation out of the legs back to normal.
The procedure itself probably took 30 to 45 minutes. I was able to get up off the procedure table right afterwards and walk. I did have improvement in cosmetically, which is a wonderful side benefit, but I also have decreased swelling, decreased aching. Really, it's very minimal.
She got a great result. Her swelling has gone away completely, her pain has gone away completely, and her varicose veins have gone away completely as well.
Our bodies need at least 90 milligrams of vitamin C per day. The best way to get all your vitamin C is by making sure to eat at least 5 servings of fruits and vegetables every day.
And we welcome you inside the Best Docs Network studio. We are happy to be joined by Dr. Doug Wan. And when it comes to spine and neck surgery, this is your go-to doctor. He is also the director and founder of Spine Care. Dr. Wan, welcome to the program.
Thank you. Thank you for having me.
Let's start it off with your philosophy when it comes to your approach to medicine. What would that be?
So we practice medicine based on, our approach is very patient-centric, providing the best care for the patient. And when it comes to spine care, spine problems are a very complex issue. And so our approach is to approach it with a very comprehensive approach. So in our center, we have from the least invasive way to the most complex way of treating spine conditions. And we have providers such as chiropractors, physical therapists, physical medicine rehab doctors, interventional pain specialists, and minimally invasive spine surgeons. And we approach it through a multidisciplinary approach and find the best way to treat the patients so that they get the most amount of pain relief.
All right, doctor, what was your goal in creating Spine Care? What did you have in mind?
When we created Spine Care, our goal is to provide the best kind of spine care to the patients. There are many patients with a very complex spine problems. However, not everyone may need spine surgery. So we approach the spine through a multidisciplinary approach, and we find the best way to treat the patients with significant back pain. That's why we have from the chiropractor to physical therapists, physical medicine rehab doctors, interventional pain specialists, and minimally invasive spine surgeon. We find the right diagnosis and treat the patient the right way and the least invasive way possible so that they can get their life back as soon as possible. Also at the Spine Care, we have high-level imaging so that patients do not have to travel elsewhere to get their imaging studies done. Also, we have our own procedure centers on campus, so therefore they can not only get the evaluation, but also pain procedures done, as well as spine surgery.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.